Snake bite, general management and first aid. Patient may be anxious and frightened, so first assure the patient and venom spread through diffusion and superficial lymphatics. Any movement increase circulation, so rapid spread of venom. So patient should be immobilized and if possible then sitting position then lying down. It slow the spread of venom to heart and bite side wound should be cleaned with fresh water or normal saline. Any suction or incision should be avoided because any incision or suction cause more tissue damage, so venom spread into deeper tissue and increase risk of more secondary infection and more bleeding and oozing of blood in case viper bite. Second, application of tourniquet. In case extremity bite like finger, toes or leg, tourniquet applied and tourniquet given at 5 semi-proximal to bite. Rubber tube, handkerchief may be used as tourniquet and tourniquet should not be continue more than 45 minutes. Every 30 minutes it should be released for 30 seconds. This allows some venom to release in circulation which get absorbed slowly and destroyed by circulating antibody. And in case of bite face or abdomen or back or head, there no place to apply tourniquet, so here firm pressure by hand giving. And any ring or ornament should be removed because edema may cause tight fitting, so cause more tissue damage. And in developed country, rather than tourniquet, they are pressure wrapper used. And during transport, the patient is immobilized by splinting. And specific management at each hospital. First, ABC mean airways. Here, remove by suction, remove excessive frothing and salivation to prevent aspiration. B for breathing, oxygen inhalation and respiratory failure, mechanical ventilation given. And C for circulation, two large bore IV access for combat with hypotension and shock. And tetanus toxoid 0.5 ml IM stat and broad spectrum antibiotic especially cover pseudomonas infection which is present on snake fangs and also prevent secondary infection by devitalized tissue like streptococcus and staphylococcus. And in cobra and kraid bite, they are neurotoxic, act on neuromuscular junction, so flaccid paralysis occur. Here neostigmine 0.5 milligram IV every 30 minutes repeatedly given to combat unless the control ptosis or neurodeficit is controlled. And atropine given along with neostigmine to combat muscarinic action of neostigmine. And respiratory paralysis occur, respiratory muscle paralysis occur, so respiratory failure combat with mechanical ventilation is mandatory. And in case of viper bite like Russell viper means Chandrabora or saw scale viper, there is coagulation defect, so there is intravascular hemorrhage, profuse hypotension, shock occur. So here IV saline and pressure agent like dopamine, norepinephrine, IV hydrocortisone used, and blood transfusion and fresh frozen plasma may be transfused, vitamin K injection, etc. And for antivenom therapy, for details about antivenom therapy, see my next video. Thank you.